If you are wondering if you are really wanting vaginal exams, or if it's necessary, or if it hurts, or like what this whole thing is all about, we're going to cover all of that in this video, talking about what is actually necessary when it comes to vaginal exams. Are they absolutely reliable? Should we get them? Should we not? When are they appropriate? All the questions that you may have about vaginal exams, we're going to answer in this video. So make sure to stay tuned to the end so you can take notes and have conversations and questions to ask your provider at your next appointment. Hey mama, welcome back to my channel. My name is Chanel. I am a doula, and I help families go from a place of feeling really overwhelmed and anxious and unprepared to feeling confident and empowered and educated with all of the tools that they need and their partners need to have a beautiful, supernatural, fearless, natural birth. So if that sounds like something that you're interested in, make sure to hit the subscribe button below and join our family. And we are going to talk about all the things that you need to know for birth and beyond. Also, make sure to follow me on Instagram, where I share daily tips and tricks and real birth stories so that you can see how all of this plays out in action. All right, now first let's start off by talking about what vaginal exams actually are. Just by definition, a vaginal exam or a cervical exam, depending on how your provider refers to it, is just an internal exam where your provider will use their hands to evaluate your cervix to see how effaced you are, how dilated you are, potentially the station of your baby, to see what's actually going on. This can be done by your doctor or your midwife, and it is believed that it can help your doctor or midwife actually see the readiness of your cervix for labor. Now, these can be done in late pregnancy, starting around 36 weeks, and they're often done in labor, especially in a hospital setting. Now, a lot of times when we think about cervical exams or vaginal exams, a lot of times people will say, well, we're gonna check how dilated you are because we wanna see how far along you are, and that can give us an idea maybe of how much longer you have to go, or if your body is progressing in labor. Doing a vaginal exam, while it can be helpful for some women, for the majority of us, it's not always an accurate representation of how long labor is going to be, how far along this mom is, or how she's been doing. It doesn't really tell us much except what is happening in that exact moment. And so when we think about doing a vaginal exam to check the progression of labor, it isn't really telling us that much information. Yes, it is telling us how far we've dilated, but if a mom has not dilated more than 1 centimeter and it's been 3-4 hours, that does not mean that she is failing to progress. And a lot of times we can use that or hear that excuse or reasoning to justify other interventions in labor. And so cervical exams are challenging because they're not always accurate, and they can be a poor predictor of what's actually going on in labor or if a mom is failing to progress. The other problem with vaginal exams is that it can easily depend on the size of the person's hand. I actually just supported a client recently, and she labored at home as long as she could, and she did a phenomenal job. She was having a hospital birth, and we had the plan of her and her husband laboring at home, getting the coaching necessary, and actually just utilizing all the tools that we'd practiced throughout her entire pregnancy to help her know when it was the appropriate time for her and her husband to leave to go to the hospital. She wanted to spend as least amount of time at the hospital as possible, and so we wanted to make sure that she had enough time to get there and she wasn't having a car baby, but she also wasn't going to be spending an overly long amount of time at the hospital. When she got to the hospital, they were super impressed. They were like, hey, we did the cervical exam, and just to admit you, because sometimes they will require you to do a cervical exam upon admittance. You can obviously decline that if you are interested in that. I talk all about rights and options and how you can decline things appropriately in my program and my coaching. If that's something that you're interested in, click the link below and we can schedule a call for that. But this mom was okay with the cervical exam. They did the exam. She was 8 centimeters. We're like, yes, all right, girl. Like, we're doing great. Obviously, it doesn't tell us how much longer she's gonna be in labor, but she did a good amount of work at home. So she did her cervical exam, 8 centimeters. Hours go by. She wasn't really interested in having another exam, but her body was clearly progressing. And they asked if they could check again, and she was okay with that. This was like hours later. This nurse was like, oh, I actually think she's like 6 or 7. That is an example of how inaccurate these vaginal exams can be. This was a completely different nurse. Their hand sizes could have been very different, and now we have two completely different pieces of information, one making it look like she regressed. So it does become an issue when we are relying on very subjective information in a way, of really evaluating where your cervix is, how it has progressed or not progressed. And that is one of the challenges of vaginal exams that we could potentially run into depending on who's evaluating you, when they're evaluating you, and the size of that person's hand overall. And then the last problem is, which we've kind of talked about already, is it doesn't actually tell us how much time we have in labor. As I mentioned before, this mom who showed up at 8 centimeters was still in labor for a couple of hours. We would have hoped, right, that she had a baby in 1 hour, but her baby was positioned in a funky direction. And one of the things that the nurses did not evaluate when doing these cervical exams was the position of the baby. Every time we asked based on what they were feeling, they're like, oh, well, we don't know. Well, you can easily do that during a vaginal exam to know what the position of your baby is. And that is also another problem with vaginal exams, is that people are looking for this information that's not actually helpful in the progression of labor, because it doesn't tell us what's going on and how close we are, the position of the baby, so that we can be accurately doing movements appropriate. And it doesn't also tell us if this mom is going to be in labor for 10 hours, for 2 hours, for 1 hour. You can go from 4 centimeters to 10 centimeters in 30 minutes. You can also take 12 hours to go from 8 centimeters to 10 centimeters. And so when we're doing vaginal exams and we're relying on this information to give us motivation, it can really mess up where you are in your birth zone. So I am not saying that you should or should not do vaginal exams. What I am saying is that you should understand the pros of it and the cons of it so that you can make the decision for yourself on what feels best for you in that moment. You have the right to decline at any time, but it is important to understand where you are mentally, spiritually, physically, to know if that information is appropriate for you to know, or if that's going to completely demotivate you to go through with your original plan to the finish line. There is no failure in birth. However, there is a way to get out of your birth zone, and that can make labor a lot more challenging. So think through all of these things, but that is ultimately what vaginal exams are and some of the problems that can arise when thinking about vaginal exams. So, do vaginal exams actually matter? Yes, but mostly no. If we see external signs of her progressing, seems like she's getting closer to the end, closer to the finish line, she's showing signs of pushing, sometimes doing a vaginal exam for those moms is beneficial, because if a mom feels pushy, for example, but she's not quite 10 centimeters yet, it can help a mom be encouraged to continue to labor down so that she doesn't tear. The other benefit to a vaginal exam is that we can also check baby's positioning and we can check on the cervix. Sometimes moms are feeling like they're progressing, they're getting close to the finish line, but they may have a swollen cervix or a cervical lip, and that can cause the process to take a little bit longer. Or baby could be in a funky position, and a lot of times when nurses or providers can do a cervical exam, sometimes they can feel the position or the station of baby if mom or partner does not know how to evaluate that information without a cervical exam. In those cases, yes, a cervical exam might be beneficial if you feel like I'm progressing, but I'm not seeing the baby's head, or I'm pushing and I don't know why things are not moving along. If you've exhausted all those options, then yeah, a cervical exam may make sense in that moment to really see what's going on. If you feel like you've done your homework, you've done and exhausted all of the options that you have had, you were taught, hopefully, throughout your pregnancy on how to move, how to evaluate the station of your baby without these exams. But if you've done all of those things and you're like, I don't know what's going on, I don't know what else to do here, maybe a vaginal exam might be a good option for you. But the reason that I say mostly no is because a lot of the things that I just talked about, the station of your baby, how far along we're progressing, really understanding the signs that tell us that we're getting closer to the finish line can be evaluated without a cervical exam. That is why it is important to get educated before you go into labor, because there are ways These are things that I teach, but these are ways that you can understand your body, that your partner can understand what's going on with your body, and know that there are signs of progression throughout labor without anybody having to stick their fingers inside of you. It is important to know that we can understand the station of your baby, which means how high or how low your baby is without sticking fingers in you. We can see that your baby is getting closer to the finish line by bodily discharge. There are so many ways that we can evaluate the progression of labor and give us a better idea of what to do, how to do it, and when to do it. And none of those things include vaginal exams. And when we just move forward with whatever is recommended to us without having the knowledge for ourselves, we actually put ourselves at a greater risk because we are overusing vaginal exams and trying to overly monitor and push and rush this process of birth that is supposed to be smooth and patient. But unfortunately, it has turned into a medical event in our society rather than a natural occurring one. So what are some of the risks that we are exposing ourselves to by doing too many vaginal exams throughout the course of labor? Number one is a risk of infection. The more times somebody puts their hands into your vagina, the greater risk of infection that you have. Number two, accidental water breaking. I don't know how many times I've seen this happen, but sometimes we've seen providers who want to get this process rolling. I've told y'all before, sometimes providers want to get this thing over with because they are gonna work the same hours one way or the other, or if they're there for you and you're the last client of the day, they're ready to go home. And unfortunately, that's some of the reality that we tend to run into. And not all providers are patient. And so what I've seen before is that we can do vaginal exams and maybe a provider accidentally breaks your water because they're trying to get things to progress along. Now, I'm not saying this happens every single time, but I am saying that it happens, and it's important to know that that is a risk, that your water could be accidentally broken to speed things along while they're doing an exam. The third risk is that it's just really uncomfortable. If you can imagine wanting to move around in labor, be active because movement is a comfort measure, and then somebody's like, all right, girl, you need to stop, get on this bed, lay on your back, knees wide open, butterfly, let me stick my fingers up you, in between your contractions, and then get back up and do whatever you were doing before. That is uncomfortable. It throws you out of your zone. You're already experiencing contractions, which for some of us can be really uncomfortable. So that on top of contractions is not fun. The fourth risk, which we've talked about already, is that it really can take you out of your birth zone. I am a thinker. I am type A. I have very high standards. And if I work really hard, I want to see the fruits of my labor, okay? So you gotta understand yourself. You gotta know, look yourself in the mirror and really know your mental capacity in labor. If you work really, really hard and somebody's like, yeah, actually, you haven't been working that hard, you're gonna feel like, what am I doing this for? And I've seen so many moms, and I coach my clients on this all of the time. It's like, really know yourself. I knew after having my first birth, where I had a lot of vaginal exams after my water had been broken, that when I was working really, really hard and I was not dilating as fast as they would have liked, nor what I would have liked, it really discouraged me really, really fast. And had I known that in my second labor, when I was working really, really hard, and I'm like, what is happening? I'm trying to get to the finish line. Like, I'm tired. This is uncomfortable. And they did one exam. I allowed them to do one exam because I learned the hard way the first time, like, I'm not about to do all that. But I did let them do one exam, but I was like, do not tell me. You can tell my doula, you can tell my husband, but do not tell me where I'm at, because I do not want to just throw in the towel. I need to keep my mind where I'm at right now. And yes, it was uncomfortable, but I was willing to do that at that moment to get some next steps, because we had really exhausted a lot of our options at that point as far as like movement and everything else. I ended up having my baby a couple hours later. When I went back and I asked my provider, hey, like when you did that exam at like 11 p.m., where was I? What was I? They're like, you were 4 centimeters. Let me tell y'all something. That was my first vaginal birth, and I worked really, really hard for that birth. If you would have told me that I was 4 centimeters at that point, I would have been like, yeah, you know what? It's cool. Like, just take me to the hospital. Like, this was a fun try, but like, I'm not about to do this for another X amount of hours. Because in my mind, that was what I thought the first time. Like, oh, I've been laboring for 12 hours and I'm only at 3 centimeters or 4 centimeters. I'm not going to do this for another 15, 16 hours just to get to 10. It doesn't work like that. I literally went from 4 centimeters until holding my baby within 3 hours. And that's possible. And I've had clients who've gone from 4 centimeters to holding their babies in an hour. And that's how fast it can go. But you also have to know your mindset on like, is that information going to be good for you to know, or is that information better for somebody else to know so that they can use that information, if necessary, to guide you on what you should actually be working on. Should you be resting? Should you be squatting? Should you be getting in the shower to relax? Like, there's so much that you can do with that information if you've done everything else that you know to do. But sometimes somebody else should be giving you the coaching and not that information so that you can stay in your zone. And the last risk is that it doesn't actually communicate the right information to you. Your body will dilate. That means you're gonna go, whoop. But that doesn't mean that your baby is right there. Your baby can still be all the way up here, sweetheart. And you need to get your baby down here. And when we hear a lot of women who are pushing for 2 hours, 3 hours, 4 hours, but they're 10 centimeters, they're confused. Like, oh my God, pushing was the hardest part. Pushing should be the easiest part of your labor. And everybody's afraid of pushing. But the problem is we look at dilation, providers look at dilation, and they're doing vaginal exams to check for dilation, but that information actually is not really helping you when it comes to appropriate times to push, appropriate things to do. When they are doing vaginal exams, they're actually charting how dilated you are, how effaced you are, and the station of your baby. High versus low, how high your baby is, how low your baby is. I have an entire series on this that you can watch and learn about it. But basically, they're not telling you the station of the baby. What ends up happening and why women push so long is that they will be 10 centimeters, but their baby is still at a negative station. And what that means is that if this is your pelvis, your baby's head is still up here. So now, yeah, you're 10 centimeters. Let's go, girl. Let's start pushing. Get on the bed, push this baby out. You're having to push your baby all the way down just to get to the point where it's actually time to start pushing and you feel the urge to push. And then by this time, you're exhausted. So if you haven't gotten any pain relief or an epidural by now, you're just plain exhausted. You have nothing left in you because now, instead of just laboring your baby down and continuing to do positions and things that will help utilize gravity and opening up your pelvis in the right place, you've used all of your energy to push this baby down into your pelvis and ready to be crowning instead of laboring down until you feel this fetal ejection reflex and the urge to push, and then your baby slides right out because you were 10 centimeters. So we're not actually giving women appropriate information that they need during these vaginal exams, and it's actually causing more tearing. It's causing way more energy to be used than necessary, and it's causing labor to take longer because we're like, okay, girl, let's start pushing. You're right there. You've done so good. But they know that your baby is still really high and above the pelvis. But we need your baby to be the bottom of the pelvis to start pushing. But if you don't know that, then you're wasting a lot of energy that you don't need to be wasting. Okay, so let's get back to the point. The point of this entire video is that vaginal exams are a thing that you can utilize, but there's so many other ways that you can listen to your body, look at your body, and know how we're progressing throughout labor if a vaginal exam doesn't sound like something that you're comfortable with. And if you do your homework in pregnancy, you will be able to see the signs, and your partner will be able to see the signs so that you can stay in your zone to know that things are progressing, like how relaxed you are, what you sound like, how far apart your contractions are. All of these things and tools that you can utilize to really see the progression of labor. Having these conversations and asking about these things, talking through your desires, talking through your birth plan with your provider very early on, not waiting until 36 weeks to do it, is important. What are their outlooks? What are their opinions? What are their beliefs about vaginal exams? How open are they to not doing them throughout labor unless you request them. When I work with my clients, we create birth plans very early on in the process, and we have conversations with our providers very early on in the process, because if you cannot support me and respect me for something that is my desire for my body and it's not medically necessary, then I might have to move on to another provider because we just may not be a fit to work together. So having these conversations early on is crucial so that you have the birth team that will help you achieve the goals that you desire. And of course, there are external situations and outlying situations that may require or be strongly encouraged for you to do an exam for the safety for you and for baby. And you should be educated enough to know when those things are being suggested, if that's truly medically necessary. That is your responsibility, because we just are not in a position, we do not have the luxury of relying, unfortunately, on medical personnel in this day and age to give us the information that is mama and baby friendly and actually focused. A lot of times things are very convenience focused. And you have to know the difference between those two and know how to recognize the difference between those two. So having those conversations with your provider at your next appointment, at your upcoming appointments, is really helpful so that you know what you're actually walking into. All right, y'all, that was jam-packed with information. So rewatch this as many times as you need. Hopefully you took a lot of notes, but I hope this was helpful. If it was helpful, please give me a thumbs up, so that I know that you like this kind of jam-packed information. This is how I teach. I'm trying to give y'all everything you need to know. I know some of these videos may feel a little bit longer for you, but this is not like a 2-hour hospital birth class type of thing. If you want that, you're probably not gonna be fully prepared for birth. So if you really wanna be prepared for birth, I encourage you to get educated, get the step-by-step process. My Work Your Birth program, we go through the mental prep, the spiritual prep, because this whole experience, y'all, is so spiritual. Like, you need to be connected mentally and spiritually, and aligned mentally and spiritually, physically preparing your body, writing your birth plan, talking to your provider, asking the right questions. These are all the things that you should be doing now in your pregnancy. And I don't care how late you are in the game or how early you are in the game, you gotta do it, and you should do it, and you should have the support along the way to do it. So if that sounds like something you're interested in, click down below. Work Your Birth. We will schedule a call, talk through your goals, and if there's a way for us to support you through this journey. That is it from me. I will see you on the next video.